Driving all night, your hand's wet on the wheel. You've been driving, your jaw is really tight, it's really sore, you're starting to get some headache. Let's see if we can't help you out with that. We'll show you a couple of things to do, help bring that pain down and give you a little bit more comfort through your whole jaw and into your head. Okay, first thing we want to do, let's just take a little bit of a baseline. How are you feeling? Is your jaw tight? Okay, so let's jiggle it. Is that feeling pretty tight? Okay. Click your teeth together. Just pay attention to where your teeth are resting. And that way we have a bit of a baseline. We can see how we're feeling after we do all of these things. Okay. So let me know if any of this works for you. And in fact, with all of these things, do them when you're at rest first. Okay. So try them just in your living room. And then when you're in your car, do them when you're at a stop sign, a stoplight, or if you're really feeling it, pull over so that you're not doing it while you're driving. We don't want to be doing things when we're distracted or anything that might compromise our ability to control our vehicle, okay? Because that just wouldn't be a good thing at all. Next thing that we can think about is the muscles on the side of the head, and our masseter muscle, which is our main chewing muscle, and our temporalis muscle in through in here. We can do a couple of different things. Obviously we want to have a hand on the wheel. If we're at rest, we could do both hands, but try to always keep a hand on the wheel. It's just good practice in any case. And we're going to have our hand just underneath this bone here. So this is our zygomatic arch, our cheekbone, we often call it. And in the front part here, you can really feel the meaty part of this muscle. And if I just slightly press my teeth together, I could really feel that front edge or that anterior edge of this muscle. So we're going to dig in here. And when I say dig, I just mean press. I don't want you pressing really hard. Okay. This is not about causing a lot of pain. We're not going to be doing this for a great length of time. We're going to press in. And as we do that, we're going to open our jaw and bring our hand down. Okay. We can even go the other way. So we can use the heel of our hand and go up like that. If you find a particularly tender spot, you can just kind of roll around here and just feel for it and just hold it. A little bit of back and forth, some circles, and be gentle with yourself. We're not trying to bruise ourselves. We're not doing this for 5, 6, 7, 8, 10 minutes. We're just doing it for like 2 minutes, okay? We can move above into this area. So the size of your fist matches your body. So just above your ear, this is how big this muscle is. So as we open, okay? I don't want to do this without my glasses on. Got to know where I'm going. Okay. And if you find something that's really tender, you might even find a spot where when you press on it, it makes your headache a little bit worse or your jaw pain a little bit worse. So just hold it gently and it should start to diminish. It might not go away all the way, but just start to diminish in about 10 to 12 seconds. If it doesn't, you're pressing too hard. So just back off that pressure, okay? And then we can change hands, do the other side. Okay? And don't get carried away. We want to do a little bit and then let the tissues relax and breathe. Get the circulation in there. This is the most important part. It's getting blood flow into these tissues. Then we can do tapotement. And tapotement is like this, right over top of the joint, which is just in front of the ear. Okay, so right in this area. And I like to use my middle and my ring finger. Gives me good purchase there. Of course, you have to be careful if you're using your middle finger, you're not flipping someone off beside you, because, that could cause all kinds of problems too. So just lightly touching. We're not doing 100 miles an hour like some kind of you know, massage that you see on Saturday Night Live or something like that. It is just a nice light bounce. We're not pressing very hard at all. And it's about 1 a second, because that will allow your nervous system to relax, our sympathetics to relax, relaxing the joint and the tissue in through this area. Okay, sends a bit of a vibration through, works really well. Do it about 10 times. Don't have to do it for hours on end. We're just doing it 10 times. You can do one side. And you can see it's like a little trampoline. I'm trying to bounce off the tissues. I'm not just going thud, thud, thud. Okay? So after this, just retest your jaw. Is it jiggling? Touch your teeth together. Has your bite changed at all? If it hasn't, check out my other video on how to get out of your programmed chewing bite and to relax these upper muscles there. Great. Happy driving.